My name is Jun. I am an endocrinologist at Monash Health, but I'm also a research fellow at Hudson Institute of Medical Research and School of Clinical Sciences at Monash University. Well, when I first started training as a doctor, I really had no background whatsoever in research. And I guess it's the curiosity about how things worked and how we can make things better rather than just keep doing the same things that drove me to try research. And my very first research exposure was actually my PhD in the molecular biology of this hormone receptor, together with Dr. Morag Young and Professor Peter Fuller at Hudson Institute. I'm very grateful for funding from the Heart Foundation to look into a potentially curable form of high blood pressure. So everyone knows high blood pressure is a leading cause of cardiovascular disease, and over 6 million Australians suffer from high blood pressure, and yet very few people know that a significant number of these patients actually have a potentially curable cause, or at least a cause that can be specifically treated with a simple medication. And this is called primary aldosteronism, or better known as Conn syndrome. So my research was all about trying to find out how common this disease is, how to increase its awareness, and how to make it easier to diagnose. With the funding from the Heart Foundation, I was able to engage with the general practitioners, because general practitioners are really the doctors who look after hypertension at its very onset. And if we can get through to the general practitioners and increase their awareness of the disease and increase their screening rates, then we'll have a chance at accurately diagnosing this disease as early as possible. And I guess with regards to the results, it's been really surprising that before we started this research project, less than 0.1% of these GPs patients or hypertensive patients had a diagnosis of primary aldosteronism. But after screening, we found that at least 15% of them have this disease. So 0.1% versus 15%, that's a huge difference. And the most exciting thing is, now that these general practitioners have gotten used to screening and have seen the amazing results, because their patients who have been found to have the disease do not need to go onto non-specific antihypertensive medications, but rather they can go onto a drug that specifically blocks aldosterone. So in these patients, the adrenal glands are making too much aldosterone, and to combat the hypertension, we actually give them a drug that specifically blocks aldosterone. A certain proportion of these patients will even have an adrenal gland adenoma or a tumour that's making too much aldosterone. In that situation, their disease can be cured with surgery. Apart from treating the high blood pressure, by getting rid of this excessive aldosterone, the patients also have lower risk of heart attacks, strokes, and atrial fibrillation. So if more GPs in the community start to screen for the disease, then we will have a much better chance at conquering hypertension and associated cardiovascular disease in quite a large proportion of the patients. Nowadays, the funding environment is very competitive, and it's almost impossible to get funding straight after a PhD. And also I actually had some time off to have children, so after that sort of a career break, it was very difficult to get back into the competitive research environment. So I'm very grateful for Heart Foundation and some other philanthropic organisations that funded my research. So it's like a bridging fund that allowed me to continue to do the work, and now we've actually had enough results to secure an HMRC grant. So it was absolutely crucial bridge.